Many believe that the Affordable Care Act, or Obamacare, will have a profound impact on Californians of all stripes: employers, employees, individual consumers, health insurance companies, and healthcare providers, just to name a few. The question, of course, is whether the costs will outweigh the benefits. What effect will the Affordable Care Act have on improving the health of average Californians? What impact will it have on California businesses, especially small businesses? What will it mean for insurance rates? And how will it change the delivery of healthcare and the way hospitals and doctors do business? We'll ask Anthony Wright with Health Access California, John Kabateck with the National Federation of Independent Businesses, Duane with the California Hospital Association, and Charles Bacchi with the California Association of Health Plans. The Affordable Care Act, diagnosing the costs and the benefits.
Additional funding for the Maddy Report made possible by a grant from Paramount Agricultural Companies, growing healthy food for you and your family.
From the California Channel at the state capitol, Valley PBS, and the Maddy Institute, it's the Maddy Report with Executive Director of the Maddy Institute, Mark Keppler.
Welcome. Today we're coming to you from the state capitol to discuss the impact of the Affordable Care Act on Californians, and we're fortunate to have two leading voices from the Capitol with us today. John Kabateck is the Executive Director of the National Federation of Independent Businesses California. Welcome back to the Maddy Report.
Thank you so much, Mark.
And Anthony Wright is the Executive Director of Health Access California. Welcome back to the Maddy Report.
Thank you.
So Anthony, we'll start with you. Basic question. Do you think the ACA is going to improve healthcare and healthcare outcomes? And if so, at what cost?
It absolutely is, and it's starting to. California, in implementing and improving upon the Affordable Care Act, has now expanded coverage to millions of Californians. Over 1.2 million Californians have signed up for new coverage options, and Covered California is the new marketplace. We also have almost 2 million people enrolled in Medicaid healthcare coverage for low-income Californians. That's not including small businesses who have a new tax credit, young adults up to age 26 on their parents' plan, a range of benefits of people getting access to coverage and getting financial help to afford that coverage. Can we afford that? We can't afford not to do this. The healthcare costs were rising at unsustainable rates over the last several decades. In the last 4 years, the rate of growth in healthcare has slowed to the slowest rate in any time in the last 50 years. So we are making progress. There's a lot more to do to control the cost of healthcare, but that's something that we need to do globally, as well as provide financial help for people who are at low and moderate incomes so that they can be in the system, get the preventative and primary care that they need, and improve healthcare outcomes for everybody.
I think you set out the entire argument for it. So, John, what do you think? Was it worth the cost?
Well, no question, small business owners want to make sure that Californians and Americans have access to affordable health care. It's been their number one concern, has been soaring healthcare costs and healthcare issues for the past, 30 years. But small business owners want reform, but unfortunately, what this law lacks is a great deal of actual affordability, a discussion and actual policy that focuses on affordability. Let's keep in mind, we're putting 5 million Californians into the healthcare system without sufficient number of doctors, nurses, administrators. At what end and at what cost is that in terms of actually fixing the process? I mean, we really look at this more as, this isn't really healthcare reform as much as it is an overhaul of the health insurance system.
What do you think in terms of impact on small businesses? Good thing or bad thing?
Well, small businesses, actually put yourself in a small business owner's shoes today. The highest sales, income, and gas taxes, the most sweeping regulations in California, lawsuit abuse across the board hitting small businesses. And now this massive amount of new costs, taxes, mandates that are affecting small business owners, it's a lot of issues that are facing them. I mean, in terms of the impact, even the Obama administration itself admitted that small business owners are going to be seeing their premiums increase about 65% over the next 3 or 4 years, and about $2 million lost jobs. I think the big question is, with that many costs, mandates, reporting requirements, is that helping to get job creators creating jobs?
Are you going to challenge some of those numbers?
I would certainly dispute many of those numbers. In fact, there is no mandate on businesses of 50 or smaller employees, and in fact, they get access to a tax credit to better be able to afford coverage for their workers. That's a direct benefit. They have a new option to buy coverage through an exchange through Covered California, and now hundreds of small businesses are providing coverage to thousands of employees through that program, and more will in the future. So, this is a big boon to specific small businesses, but also for the economy. Think about the creativity that can be unleashed when people no longer have to take the job that they have to take because they need to be covered because of their pre-existing conditions. This will unleash both entrepreneurial and artistic innovation by allowing people to pursue the careers and dreams that they want, and spur our economy in that way.
That's interesting. I have never heard that one before. It's an interesting kind of thought on the process. John, what do you think about, you were mentioning kind of the burdens on employers, and one of the things that's been mentioned is the administrative burden on some employers. Do you see that being a problem? And if it is, and most likely, let's say, for sake of argument, we're not going to repeal the law, what can be done to reduce those administrative burdens?
Sure. Well, and again, I would disagree with the fact that people who say, well, it's not going to affect small businesses with fewer than 50 employees. Well, there's a whole multitude of things that affect a small business owner when this law comes into play. Certainly, there are the reporting requirements, there are posting and information requirements small business owners are going to be required to place. And also, in addition to that, calculating. Now they're having to be experts in terms of calculating the hours of their full-time employees, which they never had to do. So they now have to be an accountant, they have to be a tax benefits consultant, an attorney. And remember, think about it, 3.6 million small businesses in California are most of the job creators. Most of them don't have the HR departments, the administrative departments. This is a huge administrative burden when small business owners want to just create jobs and be successful.
And by the way, full-time, just to be clear, right now it's defined as 30 hours. Not 40 hours, which a lot of people usually think of full-time as 40 hours. Well, listen, when we come back, we're going to talk about how the voters are likely to respond to Obamacare. That conversation in a moment. This is the Maddy Report. Welcome back. With November elections just around the corner, how are voters likely to respond to the first year of Obamacare? We're talking with Anthony Wright from Health Access California and John Kabateck from NFIB. Anthony, how do you think the general public is going to view Obamacare as we roll it out? Are they going to warm to it? Are they going to cool to it? What?
Well, in California, we've been fortunate to be spared some of the partisan warfare that we've seen in D.C. and some other states. The Affordable Care Act, Obamacare, has consistently enjoyed 55% plus approval ratings among the California public. Pollsters have never seen that level of consistency before for other policy initiatives. So there's a solid base of foundation. And we've had actually a broad consensus among not just consumer advocates, but legislators, political leaders, but also parts of the industry, providers, insurers, that they want this to succeed in California. And that's why California has actually made great strides. And so what we're seeing nationally is that there's actually been an uptick in improvement as people are starting to see the benefits of the law, starting to see, once people get away from the politics and see the practical, what does this do for me? What is the new options that I have? I think that those numbers will actually improve. But in California, it really is it has been not the political partisan. We've even had bipartisan votes on some of the bills to implement health reform in California to show that it really is not the same conversation that we're having in D.C.
Yeah, I'd seen a PPIC, Public Policy Institute of California poll that showed 53% support in California. But nationwide, that's not the truth. The number's a little different nationwide. And nationwide, it's more about 40% level of support. So, John, what do you think? Are people going to warm or cool to Obamacare or the ACA as it rolls out over the next year?
Well, I think time will tell as we look ahead this year. I think so far the prognosis hasn't been good, and whether you're talking to Democrats, Republicans, women, men, young, old, there seems to be so much frustration with delays, moving the goalpost, fix after fix, patchwork fixes, that people are so frustrated right now. It's no surprise that the Gallup poll recently did show that 57% really don't think that that the administration is actually helping healthcare. So, we'll see, but I think the question people are going to be asking is, will premiums be going up? Will people be losing their coverage? And most importantly, will people be able to get the answers they need?
Well, let's translate that to the election. Elections in November. How do you think it's going to play out?
Well, I think this is going to be one of those issues that really is going to be a motivator in different ways, probably for both parties, if you ask. I think another poll, the USA Today just recently showed that 54% of Americans believe that this law is going to impact their way of voting for candidates. But again, that same poll showed 2-to-1 oppose the law and don't think it's the right direction. So what are we going to see? We're going to see probably Democrats pivot a little bit. We'll see Republicans pouncing pretty hard. But I think, in fairness, what Republicans need to do is make sure that they're talking about what fixes need to be made and also how they would provide relief for small businesses.
Anthony, I saw a CBS poll that said that 70% of Republicans are very motivated for the November election, and they attribute that to Obamacare, the ACA. They said 58% of Democrats. So what do you think is going to happen in the November election? Who's going to be motivated? Or will they? Will they just, this will be old news at that point?
I mean, at some level, I think that this is actually seeding into the woodwork. Elections are about the future, not the past. And I think what the one area, even though the Affordable Care Act is contested not so much in California but in other places around the country, the thing that's clearly unpopular is repeal. That's just simply an unsustainable of a position. It's unpractical because so much of the law has already taken place. But people don't want to go back to a system where insurers get to deny people for pre-existing conditions. People don't want to go back to a system where people who think they're covered find that they're not covered once they actually get sick. So I don't think that the repeal message is a winner either. And I think that folks who have that position will be at that will be a position to their detriment. The people who have complaints about the Affordable Care Act, a good portion of them are people who wished it went further, people who wished that it took additional steps, and that's something that actually we should consider here in California, where there is at least a political will to continue the conversation rather than just to have gridlock, which is what we faced in D.C.
Okay, so John, we've got millions of people that are gaining coverage because of the law. Let's assume, for sake of argument, that it's not going to be repealed. What could be done to improve the law?
Sure. Well, again, I think what we hear from small business owners, and I think Americans right now, is that this law should have and really should be focusing on affordability, not just coverage, but how do we pay for this? And I think that's a big concern people have. Frankly, a few things we hear from our members is, I know people feel that a lot of this law is so much of gotcha government. We hear it in California quite often, but it's certainly across the nation, this gotcha government. The taxes are so egregious and so picking the winners and losers that it's very, very hard. You've got a health insurance tax that's going to be hurting a lot of small businesses versus the larger businesses and unions. You've got picks and chooses in terms of taxes that are going to hurt the medical supply industry. And tanning salons, but not others. So I think first of all, remove the onerous taxes, stop the mandates, which is again gotcha government, and most importantly, I think one area of it that we think is helpful is actually focusing on the exchange.
So we're going to end on that on a positive note. How's that? But differences of opinion, which is not surprising. Well, I want to thank both John Kabateck from NFIB and Anthony Wright from Health Access California. Well, what does the ACA mean to California insurance companies? That conversation in a moment. This is the Maddy Report. Welcome back. So how are California's insurance companies responding to the influx of new enrollees? Our guest is Charles Bacchi, the Executive Vice President of the California Association of Health Plans. Welcome to the Maddy Report, Charles.
Thank you very much. Glad to be here.
A lot of people are focusing on the total number of people that have signed up for health insurance, but it seems to be the more important issue is the mix of those people. How many healthy people are signing up? Are you at all concerned, or insurance companies at all concerned about the mix of enrollees?
Well, absolutely. For health insurance to work, you've got to have a number of healthy people buying coverage to offset those with serious medical conditions and high medical costs. So yes, we're obviously very, very concerned. However, open enrollment just closed a few weeks ago, and health plans are still accepting payments for premiums. So we're not going to really have a real good picture of that risk mix for a few more months and maybe even a year.
It seemed like the stuff I was reading that in the last month there was about a big increase in the number of young people procrastinate, and about 28% of the March signups were young people. Well, that's probably good news for insurance companies. Did you assume when you were looking at this, that initially that sick people that needed insurance would most likely be the first ones to sign up, and did you factor that into your rates?
Yeah, so there's a lot that goes into estimating what premiums will be in the future. You have to look at what medical costs are both prospectively and retrospectively, and you have to look at the overall health of the population that you're going to cover. And so we did indeed estimate that because of the changes in the law that allow people with pre-existing conditions, high-cost medical conditions, to buy coverage, that there was going to be some pent-up demand, and that folks would be buying coverage and then very quickly moving to receiving care that they've been unable to pay for many, many years. So we did build that into our rates, but it's an estimate, and we won't know the reality whether we were right or wrong on that estimate for quite a while.
Now, actuaries would tell you it's a science, but my sister-in-law is an actuary, so I think she'd agree with you. It's an estimate. The ACA contains a number of things that will mitigate the impact on health insurance companies. What are they, and why were they needed?
Well, they were needed because what this law does by, again, allowing people who have serious health conditions to buy insurance, that has a potential, and this has happened in other states that have tried this, what happens is more and more sick people buy coverage, and as premiums increase, healthy people drop their coverage because they're going to take the risk that they're not going to get sick. And that creates what's generally called a death spiral, where costs rise, premiums rise, healthy people drop. So the federal law has a number of elements that were designed. They're called the 3 Rs: reinsurance, risk adjustment, and one that I'm forgetting right now, risk corridors. They basically move money around. And for the plans that have healthier people, they will move them to plans that have sicker people. So it's very complicated. They've been mischaracterized, but they're very important, but they're also temporary. And so they only last for a year or two.
Health insurance premiums, people have been complaining, frankly, that they've been going up for years, but there's lots of reasons for that.
Yeah.
Older population, different, more expensive medical care. Do you think the Affordable Care Act itself is going to have any impact on rate increases?
Well, actually, the Affordable Care Act itself is kind of expensive. It didn't do a ton to actually lower health care costs. Now, for the consumer, there are going to be some who pay more, and there's going to be some who pay less. Those who pay less will be those of lower income who are eligible for subsidies, and those that pay more will be those who make higher incomes and aren't eligible for subsidies. But the fundamental cost of care, there was actually a number of things in the Affordable Care Act that increased costs. I think the big question is long-term, in order to lower healthcare costs and to lower those premiums, health plans and insurers really need to work with hospitals and doctors and physicians groups collaboratively to try and come up with ways to provide quality care at lower cost. And there's a number of initiatives in the works and that are ongoing. We think that's a much better collaborative way to lower costs. You really can't expect politicians to do a good job at lowering healthcare costs.
Well, I'll leave that one alone. What about this emphasis on preventive care? You think that's going to have a bigger impact in lowering healthcare costs long term than the fact that we have these people who are, pre-existing conditions, people who are previously sick, entering into the system?
Well, it's obviously important. I mean, the law provides free preventative care for Californians, and health plans are covering that right now, and that's a huge deal. And yes, long term, you're absolutely right. It is going to help control costs, especially people with chronic conditions. These are folks who have 3 chronic conditions, and they're constantly seeking high-cost services. Preventative services can help, but again, that's longer term, and so you really have to have still that balanced risk mix, purchasing coverage, for that to really pay off someday.
So a little bit of a bump in the road initially, but maybe long term, possibly better. Well, I'm going to thank Charles Bacchi with the California Association of Health Plans for joining us. Up next, what impact is the ACA likely to have on California hospitals? That conversation in a moment. This is the Maddy Report. So what do California hospitals think about the ACA? We're now joined by Duane, the President and CEO of the California Hospital Association. Welcome to the Maddy Report, Duane.
Thank you.
Well, I was wondering, is the ACA good news or bad news for California's hospitals?
Both. The California Hospital Association supported the enactment of the ACA because we believe that expanding coverage to the uninsured is extremely important as we move towards the future and in making health care not only accessible but affordable to the population. However, when you look at it from an individual hospital standpoint, there is no single answer. It depends on the hospital's service area, the population of the breakdown, how many Medicare patients they have versus Medi-Cal versus uninsured versus commercially insured. And so every hospital is different. And
so excuse me for interrupting, but would that mean, like our hospitals in the San Joaquin Valley, would it be a more difficult challenge?
Well, it depends. Again, you can't make a judgment about everybody in the Central Valley. Okay. However, if a hospital has a large number of uninsured patients, getting coverage for them will help them financially.
So that would probably be a good idea for the San Joaquin Valley.
But if they have a large number of Medicaid or Medi-Cal enrollees, they're going to get more because of the enrollment increase in Medi-Cal. However, Medi-Cal only pays 68% of the cost of care. And so these individuals are going to come in and only part of the bill is paid, and therefore the hospitals end up with bad debt. So charity care will go down, but bad debt will increase. And remember that under the exchange, for the people that come in and covered California, they are going to be responsible for 30 or 40% of the bill. and that will end up being bad debt to hospitals. So that's why you can't make a generalization and say it is financially a better solution for every single hospital, because that's just not accurate.
So what about these situations where patients start treatment? Let's say they're covered by insurance. They start treatment, then they stop paying their premiums, and they lose coverage under insurance. The hospital stuck with the bill?
Yes. Now, the grace period that the government gives people for not paying their bill if they've been paying premiums could have some effect on it. But if they have a long-term treatment program and the coverage stops, then it'll end up being, it'd revert from bad debt to charity care because of the rules.
Okay. Do you think the ACA, Obamacare, is going to change the way health care is delivered?
I think that two things are going to happen as a result of Obamacare. First of all, we're going to get additional coverage, but then the second is a huge backlash from the public. Why? Because of the narrow networks, first of all. The qualified health plans have excluded a lot of hospitals and doctors from their networks, and in many cases they're the high-cost institutions that have trauma centers and transplants and medical education and so forth. The high-cost hospitals, and many of them are excluded. So they'll go into those hospitals as out-of-network patients. And many people do not even understand that their doctor is not in the network of the exchange. And so these narrow networks, by excluding a lot of the hospitals and doctors in the state, are going to create a backlash from the public. But the big one is going to come when they have to start paying these amounts out of their pocket. And most people that take Obamacare do not realize that they're going to be responsible for 30 or 40% of the bill if they take silver or bronze plans. And that will create a political pressure on everybody, and how we deal with it is really important.
But do you think that the way healthcare is going to be delivered in the future, with the increased influx of all these patients, it's going to force hospitals to even be more efficient? Is going to bend the cost curve for healthcare, do you think?
Obamacare is not going to bend the cost curve, it's going to increase it. However, let's look at the long term, because we can't continue to have healthcare costs increase like they are. Therefore, the undercurrent of Obamacare will be that we have to change the way we deliver services. We have to change the way services are used and then demanded by patients. So the lining here, the silver, is that we are going to be pushing everyone, consumers, providers, and payers, into a more efficient system overall, where people are more responsible for their health and where care is integrated, provided more efficiently across the entire continuum, from wellness and prevention to acute care to post-acute care, chronic conditions, and advanced illness. So I think, looking down, by 2020, we are going to be better off.
Well, I'm going to leave it on a positive note. I want to thank Duane Donner with the California Hospital Association, as well as Charles Bacchi with the California Association of Health Plans, Anthony Wright with Health Access California, and John Kabateck with the NFIB, all of them for joining us. If you want to stay current on local and state politics, you can sign up for our free e-newsletter, The Maddy Daily, by logging on to our website at maddyinstitute.org. The views expressed in the Maddy Report are those of the individuals participating in the program and do not necessarily reflect those of the Maddy Institute, the California Channel, Casey, or Valley PBS. If you'd like to share your thoughts about the points and opinions shared in the Maddy Report, visit our website at valleypbs.org/Maddy. This is Mark Keppler for the Maddy Report. Thanks for joining us.